Assalamualaikum doctors. In this video I am discussing about limping children, child or joint pain chief complaints, that is juvenile idiopathic arthritis history. So the task can be 10-year-old girl with knee pain, child presented with jaw pain, or child with knee and hand pain for 4 months. Okay. So as usual, chief complaint analysis. If limping the child first, is it unilateral or bilateral? Onset, course and durations. What make it better? What make it worse? It is very important. When started, how long suffering condition, it is acute or chronic, we can know that. Then painful joint analysis of the pain, like site of the pain, exactly where, when started, then timing, any specific timing it is occur or not, associated with anything, and about the radiated, it is radiated to any other site. If I give him 1 to 10 scale, then how much you give, very important this question. And other joint, how many joint involvement, previous any similar attack, it's first time occur or previously occur. Then about the look, how it look like, swelling, red color, that is feel, how it feel, it is tender or smooth movement, it is, he can move his arm and leg freely, the affected joint freely. These are we are asking on the chief complaint analysis. So normally before difficulty to pass urine, history of any sore throat, history of diarrhea, these are before happened or not, preceding illness we need to exclude. Then what tests were done for him, as it is, if it is chronic JIA, then more than 6 weeks, so anything done for that. General FWSL, fever, unplanned weight loss, change in appetite, decreased activity, sleep disturbance, pain at night and morning stiffness. Other concern like any dysmorphic features, long-term medical condition or chronic illness. If yes, all past history. So any long-term medical condition presents or not. Now I am going systemic review. MSK, skin spots, pigmentation, skin lumps, joint pain, joint swelling, bone pain and hair nail changes. So in very important, MSK, skin spots, pigmentation, any skin lumps, joint pain, joint swelling, bone pain, hair or nail changes. GIT about the tummy pain, tummy distension, recent change in the poo and mouth ulcer, CNS, headache, morning vomiting, facial asymmetry, curving of the back, unusual gait, unusual movement, mood change, eye deviation, unusual features in eyes, any concern about the vision, hearing and speech. Hematology about bleeding, bruising, recurrent bugs, all details, especially the sickle cell disease or hemophilia. So very important, any bruising, bleeding, because sickle cell disease is one of the DD. So we know sickle cell disease features are jaundice, dactylitis, private part swelling, jaundice, pale, the child is pale, and sickle cell crisis can be also present. So bleeding, bruising, very important, we ask. Hemophilia also we can keep, because of family history also positive, and history of any bleeding trauma, recurrent trauma, bleeding with trauma, that is trauma or anything, any tooth extraction, any surgery, trauma. Chest about difficult breathing, recurrent bugs and chest pain, endocrine, diabetes mellitus, thyroid, Edison, research, urinary changes in the pee, amount, color, frequency, pain, swelling in the private parts, serious about the awareness of heartbeat, heart racing, intolerance to exercise, easy fatigability and blood pressure. Past, very important, 5T IOA, history of any fall or trauma, history of any travel, camping, Lyme disease, medicine, steroid taking or not, contact with birds, recent viral infections, acute myositis, transient synovitis. So contact with birds, very important. Visiting maybe any farmhouse, history of blood transfusion, sickle cell disease. So any blood transfusion we need to keep in our mind. Parental history, any medical conditions of medicines taken during pregnancy, screening for DDH, developmental dysplasia of hip, very important, any bone deformity that needed treatment. So screening for DDH done or not. Puberty, if around the age, did earlier started menstruation, did early show features to be a young man, like we asked. Vaccination we ask, allergy like atopic march, allergic rhinitis, asthma and eczema. Nutrition, cow's milk protein allergy we ask. Development, growth chart, loss of skills, difficulty in writing or wearing clothes. Family history of similar conditions, psoriasis and consanguinity. Social, then school type, absence and performance. Psychological or impact, how does this condition affect the family. Special consideration in different scenarios like rickets. So rickets, wrist and knee joint swelling, head size, tummy distension, sun exposure, calcium and vitamin D supplementation. So these are wrist or knee joint swelling, head size, very important, tummy distension, sun exposure, calcium and vitamin D supplementations. Osteogenesis imperfecta is bone deformity, hearing concern, device in brain. So when we ask hearing, they have hearing concern. NAI, who cares for the child, weight and height, napkin rash, previous fracture, referral to social service. So napkin rash, if the child is the age corresponding napkin rash. Muscle weakness like unilateral, bilateral and onset, course and durations. So limping child or joint pain, the differential diagnosis are, first of all, we can keep like monotrauma, non-accidental injury, infections like septic or post-streptococcal, inflammation, transient or reactive, blood disorder, sickle cell disease, hemophilia, Perthes disease, and SUFI, complex regional pain syndrome. Then poly are like psoriasis, enthesitis-related arthritis, synovitis, reactive, Kawasaki, PIMS, muscular purpura, parvovirus, rheumatic fever. Mono are oligoarticular JIA, psoriasis, ERA, synovitis, malignancy. Poly JIA, SLE, diabetes mellitus, psoriasis, ERA, that is IBD, tuberculosis, Lyme disease, malignancy, and sickle cell disease. Painful, these are according to age, they also classify. So this is all about the history. We know that oligoarticular JIA, if that is 4 joint and less, and polyarticular 5 joint or more. So oligoarticular JIA 4 joint or less, and polyarticular JIA 5 joint or more. Remember eye, very important in JIA asking, because they have eye uveitis present. So this is all about JIA history. Thank you.